Hello, I'm Lisa Arterbright, and today I want to talk to you about pre-hospital providers and adequate airway management. When I say pre-hospital providers, I'm referring to anything from first responders, to EMTs, to paramedics. And airway management can be anything from basic mouth-to-mouth to you can use a bag valve mask to provide mechanical ventilation, and you can use a combi tube, which is a supraglottic airway device that can be inserted blindly, as well as a king airway that is a supraglottic airway that is placed blindly. The only difference between those two and an ET tube is that when you go to intubate your patient, you use a laryngoscope and you have to be able to visually see a patient's vocal cords. It's not a blind stick. So when considering what type of airway management you want to provide to your patient, you want to consider how much help you have. Is it just you and your patient, or just you and your partner if you have a patient that's in cardiac arrest? Or are you going to be tied up the whole time, checking your equipment and preparing your equipment the way you need to be, and you're not bagging your patient or providing them oxygen the whole time because your partner's tied up doing CPR? So do you have a second truck coming for additional help? Do you have a first responder on scene that can provide you with an extra set of hands? What if your patient's in a house that they don't have any power, you're in the dark, you're not going to be able to see what you're doing to be able to get that airway? What if your patient has some kind of foreign body obstruction that's blocking their airway? You would need to be able to visualize to get that out before you could place any type of advanced airway. So in theory, does pre-hospital intubation do a patient more harm than good? It's been debated for years by National Registry whether intubation is something that should be took out of a paramedic scope of practice or not. Often in my case, I've seen a lot of paramedics show up on scene and they spend 5 minutes trying to place an ET tube without bagging their patient or ever putting their patient on oxygen, and once your patient goes 3 minutes without oxygen supply to their brain, they kind of is just brain dead. So even if you get your ET tube placed, you've done the patient more harm than you have good. I mean, is it realistic for us to think that every patient we have we're going to be able to visualize vocal cords and get an ET tube? Probably not. Patients that have choked and they have foreign body obstruction, or they have some type of food in their airway or something blocking, you're not going to be able to visualize that. So what type of patient outcomes are going to come of this? If we did away with intubation, we'd be more focused on the basics of, basic life support with CPR, getting actual medications on board, and just putting a simple airway such as the king airway in and providing oxygen while moving on to more important things. Something to consider though would be nasal intubation. If you have a patient that's in extreme respiratory distress, you can actually assist them in nasally intubating them and provide adequate oxygen. Or you may have a stroke patient or a seizure patient or a patient with some sort of head trauma and they clench up, so you can't really access their mouth to be able to get any type of advanced airway. So it would be nice to be able to nasally intubate a patient in situations such as those. So in conclusion, with the argument, pre-hospital intubation is not necessary. It comes in handy to already have that done when you get a patient to the hospital and it's kind of just placed there, and the respiratory team can just come in, hook their machine up to everything is good to go. But like I said, it's not necessary. At times you may want to realize that it's more important to just use some simpler method, like even if you could just bag and give a patient 15 liters of oxygen and then perform high quality CPR, that's more beneficial to your patient than that ET tube would be. And sometimes you just don't have enough people. If it's just you and your partner on scene, I mean, you just, if you got 4 people, if you got 2 trucks responding to a cardiac arrest, that's great. You've got somebody to do CPR. You've got somebody to push meds and start an IV. You've got somebody to maintain the airway. It's not perfect world like those ACLS videos you see in class when they initially teach you these things. So, moral of the story, in my opinion, as it's always been said, basic life support should always come first. And if you have an opportunity and enough people to provide an advanced airway, then it's a phenomenal skill to be able to have and be able to use. But at the end of the day, I think it's just something that's not necessary that we get too caught up on and forget to just do the basic things.